important to not only rely on medicines to combat corona, but also to increase the immunity. We should not forget the pathogens we are speaking about, we are dealing with virus, bacteria, and fungus, and different types of strains of those pathogens. They were existing even before the evolution of human species. They have immense capacity to change their structure to keep surviving. And with overusage of antibiotics, they are becoming drug resistant. So, what is the solution? The solution is to increase the immunity, to empower our immunity. And Ayurveda gives us the Vedic algorithms to do it in a fantastic way. Today, we are so blessed with for having another brilliant mind of Ayurveda, Dr. Vishnupriya Seetharamanji with us. She has specialization in Kayachikitsa. She is having Ayurveda, both her parents are Ayurvedic practitioners. So Ayurveda is a part of her genes. Today, she will take us through the protocols and the better understanding, deeper understanding of immunity from the lens of Ayurveda. So I would like to welcome Dr. Vishnupriya ji on this forum to take the session away. Good evening, ma'am.
Good evening, ma'am. So, ma'am has already introduced me. So, I am Dr. Vishnupriya Seetharam, who is a BMS and MP holder, and I'll be dealing with the concept of immunity in Ayurveda. So, we already know how exactly is immunity helpful in preventing some diseases, and what exactly is the term immunity, and all these things. But Ayurveda considers immunity in a different way. Like, it is not only through the diet and exercises that we can build the immunity in a person. There are other factors as well that affects the immunity in a person. So if we consider that also while strengthening the immunity, it would be more better and fruitful. So today in this session, we'll be dealing about that. Okay, so okay, so here Acharyas have explained in Ayurveda that there are different factors that help in a disease to happen. So one factor is Ahita Ahara. Sorry, there are some audio disturbances. Can someone mute the mic?
Ma'am, you have to mute it because you are the host. Sunil ji, please mute yourself. Ma'am, otherwise you choose the participants and mute them. Yes.
Okay,
sorry, ma'am. Please carry on, ma'am. Sorry.
So okay, so it is done, right?
Yes, ma'am. Yes, ma'am.
Okay, fine. Okay, so here Acharyas have explained about Ahidahara. Ahidahara is the incompatible foods, or the foods that are not compatible to a person, or any kind of bad eating habits, such as eating a larger quantity of food, or like eating very less quantity, or eating spoiled foods, or junk foods. All these come under the heading of Ahidahara. Along with Ahidahara, Acharyas have also mentioned about Kala Viparya. So what exactly is Kala Viparya? It is the seasonal variations that can happen in a person, and this can alter the immunity of the person, leading to the disease production. Apart from both of these things, there are other factors also, like Prajnaprata. So Prajnaprata is actually understood as intellectual errors. So intellectual errors in the sense a person is not able to identify what is good, what is bad, or what is social and what is antisocial, and they behave in a peculiar way such that their mental factors are also getting affected, and that is how they get a reduced immunity and thereby leading to various disease productions. So that is one thing. And lastly, acharyas have mentioned about inappropriate use of sense organs. So we already know Ayurveda stresses upon the fact there are 5 sense organs. So appropriate use of these sense organs are also very crucial point in our life. So if at all we are using these sense organs very much, or like excessive use of this, or inadequate use or misappropriate use of these sense organs, all these contribute towards a disease, and that is how a person gets afflicted. So we need to know what all are the individualistic variations that may happen. In Charaka Sutra Sthana 28 chapter 7 sloka, Acharyas have mentioned Nahi Sarvani Apatyani Tulya Doshani, which means that not all the apatya foods that we consume, or not all the incompatible foods or unhealthy foods cause a equal vitiation of the doshas. It means, indirectly, it means that doshas get unequally raised. So that is the understanding of the first line. Naja sarve doshas tulya balaha. That means it is not all the doshas are not having the equal strength. Like, for example, the kapha dosha, if it is aggravated, may not be much strong. Whereas if vata dosha is aggravated, it may be more strong in a person and it may lead to more severe diseases. So that is the understanding. Nacha sarvani sharirani vyadhikshamatve samarthani bhavanti. That means not all the individual bodies are having the equal power of resistance towards a disease. That means each person acts differently towards a disease. And that is covered under the concept of vyadhikshamatva. Further, in this verse, Acharya mentions that vyadhikshamatva Vyadibala Virodhitvam Vyadi Utpada Pradibandhakatvam iti yavat. That means here Vyadhikshamatva can be understood under 2 scenarios. One scenario is when a person is afflicted with a disease. Another scenario is when a person is not affected with any disease but is healthy also. So in the first case, in the first scenario where a person is afflicted with a disease, there Vyadhikshamatva plays the role of Vyadibala Virodhitvam, which means it helps in reducing the strength of the disease or reducing the intensity of the disease. So that is how Vyadhikshamatva plays a role. And Vyapada Prakatva, this is in a scenario where a person who is healthy is to be understood here. So here Vyadi Utpada Pradibandhagatva, which means that the healthy person needs to prevent a disease from getting afflicted. So that is how Vyadhikshamatva helps. So these are the 2 understandings of the term Vyadhikshamatva. Now we need to know what all are the factors that determine the Bala. So Bala, in the sense, it is the immunity of a person. So this can be determined by various factors like Balavat Purushe Deshe Janma, which means it might be the Desha or the geographical region where the person resides. So that is the Desha, either residing presently or might have resided during his or her birth. So the geographical region is also yet another factor that contributes towards the immunity of a person. Next is Balavat Purushe Kaleja. That means it is the time factor or the seasonal changes that may happen that leads to the immunity variations. And fourth one is Bija Kshetra Guna Sampajja. Bija refers to the gametes. So gametes in the sense it might be the sperm or the ovum. And Bija Kshetra refers to where it resides exactly. So where it is from the reproductive organs. So it may be the male reproductive organs or the female reproductive organs. Both are required to be healthy while conception, so that we'll get a progeny which is more healthier and is also having a good immunity power. So that is it. And next step, telling about ahara sampacha, which is the crucial point. That is, ahara also should be contributing towards proper immunity. That means ahara that is very much satmya to the person, ahara that has not been spoiled and taken in a right time. All these things determine the bala. And next is Sharira Sampacha. That means if a person can maintain the body in a very proper way through proper vyayama or some other pranayam or any kind of activities, that is also yet another thing that can determine the bala. And sattva samparsha. Sattva is a concept that is explained in Ayurveda, very unique concept. And here, sattva can be understood as three different types of sattva, which is pravara sattva, madhyama sattva, and avara sattva. So here, if we consider the case of COVID-19 pandemic, and if we are considering some people, the pravara sattva person will consider it as a COVID-19 pandemic is a disease. Okay, we understood about the pathophysiology. It is fine. If I consume a normal ahara and if I do more of the exercise, I can withstand this disease. So that would be the mental thinking of pravara sattva person. Whereas madhyama sattva person may not be thinking as such, and they may be little demotivated. And if they get some motivation from some person telling about the various aspects of this disease and how we can prevent this, all these things, they get convinced and they follow all these things, and they start to develop some kind of confidence towards beating up the disease. So that is a madhyama sattva person can do. And avara sattva person will be already destroyed, and they may think that this is the end of the life, and they may not survive the disease also. So in total, their mental status will be very much deteriorated, and it may even lead to various other disorders as well because of the reduced immunity. So that is the importance of sattva. So if a person is having good sattva, then there is always a chance of developing good bala. And next is yavana. So during the yavana, that means during the young age, a person is considered to be having good bala. And next is karma. So if at all a person consumes more of the patyahara and doing more of the patya viharas or good activities and vyayama, but still if a person acquires some disease, then we need to consider the disease as due to some sort of karma that was done in the past. So karma is considered to be as the deeds that was did in the previous life. So that is karma. And samharsha, that means it is the happiness of the person that determines the bala. So now moving on to the different types of bala that is explained in Ayurveda. So basically there are three types of bala. So one is sahaja, another is kalaja, and third one is yuktikrita. So sahaja, which refers to as the bala that is inherited from the parents, and in modern parlance we can correlate it with innate immunity. Kalaja, which refers to as that is related to the time. That means with time, if a person gains some sort of immunity. So that is coming under the heading of Kalaja Bala. And Yuktikrita Bala, which is acquired immunity in modern parlance. And this is like it is acquired through various medicaments or various activities. So here Sahaja, we need to think up to the level of chromosome levels, and that is how we can get a person with a good Sahaja Bala. Whereas if we need to think of Kalaja Bala, it might be the time of day, season, age, place of birth, all these things contribute towards the Kalaja Bala. And Yuktikrita Bala, it is like by the person resorting towards different kind of Oja Vardhakara, Aharas and Viharas that may lead to proper Bala. So these were the three types of Bala. Now we need to know how to increase the Bala. So Bala can be increased by three things, by three methods. One is by consumption of Satmya Ahara. Satmya Ahara, it refers to as the compatible foods. So how exactly can we understand the Satmya Ahara? Like if a person is Satmya towards milk, then even if the person consumes it whole, throughout the life, it may not create any kind of immunity disorders. Whereas if a person is not consuming milk or is asatmia towards milk, like for example, if a person is having lactose intolerance and we give milk thinking like it is going to increase the calcium levels, it is going to give more of the protein and all this, we are thinking a good thought. And if we try to make the person consume this milk, then there would be immunity related disorders for the patient, because that person is asatmia towards milk and we are trying to give it. So that is how satmia works. So if we are trying for a good benefit, then we have to give satmia aharas, and That is how Satya works. And next is about the Vyayama. So Vyayama refers to the exercise. If at all a person likes to increase the Bala and thinking of some kind of exercises, then the first and prime thing that we have to think is when exactly to stop the Vyayama or when exactly to stop the exercise. Acharya explains that if a person is willing to do the Vyayama in a dinacharya or like in a daily basis, then he or she has to stop the exercise as soon as they reach the level of Ardha Shakti. That means as soon as they reach the level of half the strength of their body. So once they reach the half strength, then they are recommended to stop the Vyayama and move on to the next routines. So here they are, in simpler words, we can identify how exactly a person is having the half strength or when exactly a person reaches the half strength. When a person develops sweat on the forehead, so that is how we can assess the Ardha Shaktya or like half of the strength of that person. And that is when we have to stop the exercise and move on to the next routines. So that is about Vyayama. And telling about Rasayana, Rasayana is a rejuvenation therapy which includes both Ahara and Vihara, which includes both the food and also the mental factors that can contribute to increase the bala of a person. And it nourishes all the rasadi dhatus, rasadi sapta dhatus. There are 7 basic tissues explained in Ayurveda, which is sapta dhatus. So if a person consumes a proper rasayana or if a person practices proper rasayana, then there is always a probability that a person can increase the bala. So that is it. Now coming into the concept of Satmya. So Satmya, it is like adapting towards the Patya Ahara and leaving the Apatya Ahara, which is unwholesome foods. And because of this practice, there is a good digestion of food, and this leads to the proper formation of the Sapta Dhatus or 7 Dhatus, and later it leads to the ojas in a good condition, and that is how a person develops good immunity. So that is about the concept of Satmya. In modern parlance, we can understand this as if a food is containing arginine and tryptophan, it helps in cell proliferation and also macrophages adequate activities like antimicrobial activity, tissue repair activity, and anti-inflammatory activities. And if the food is having zinc and vitamin A, it promotes the cell proliferation, it inhibits the transcription factors, decreases the pro-inflammatory cytokines, regulates the Th17 and Th19 cell differentiation, and initiates the growth of Treg cell population. So because of all these things, it is going to increase the immunity levels, and that is how the food and immunity is related to each other. Now, next concept is about the Vyayama. So there is a daily Vyayama that is explained in Dinacharya, and it increases the digestion. Because of the increased digestion, there won't be any ama, or it eliminates the ama, and it can also be eliminated via the sweat pose while doing the Vyayama. And later this strengthens the dhatus and promotes the bala, which is the immunity in a person. In modern parlance, there are many research articles that prove the relation between exercise and immunity. So here they explain a hypothesis that when a person resorts towards various kind of activities like exercises, what happens is like there is osteocalcin that has been released from the bones. And because of that, there is intake to the muscles, and the nutrients uptake happens in the muscles and utilization also happens, and in turn it releases the ATP, and it also releases the interleukin 6, and this indeed this causes the fatty acid production and also the glucose production. So this is how the immunity is being maintained in the body because of exercises. So now moving on to the concept of Rasayana, as I have already mentioned, Rasayana is that which can nourish all the Sapta Dhatus and increase the Bala of a person. So there are various Rasayanas that has been explained in in Ayurveda. So one is Ahara Rasayana. So Ahara Rasayana is the Rasayana practices that we can adopt by consuming different foods that are having good antioxidant properties and anti-inflammatory properties and all this. Vihara Rasayana, it is like those rejuvenative therapies, which include various activities that can increase the Bala or immunity of a person. And Acharya Rasayana is directed towards the immunity that is built up due to a good mental factors. And Aushadha Rasayana is by the intake of various medicaments that are rich in antioxidants and anti-inflammatory factors and all this. So in detail, Ahara Rasayana, like Acharyas have mentioned, consuming Ksheeragrita. Ksheeragrita Apyasa is a good rasayana. So that means if a person can consume daily milk and grita or ghee, it is a good ahara rasayana. Timely eating, that is also yet another concept that we need to remind ourselves. And also a person who can take not less food, or if a person can take adequate amount of foods, not more. That means if a person can avoid taking more of the foods, and lastly, avoiding preservative added foods, refined foods, fried foods, all these things are considered to be under the heading of Ahara Rasayana. Now, moving on to the topic of Vihara Rasayana, here there is a timely exercise or rest and sleep. All this contribute towards a good bala for a patient or a person, and even no addictions. That means if a person is not getting addicted to any kind of vihara, like smoking, maybe drinking, or like drugs, all these things can be a very good vihara rasayana. Talking about acharya rasayana, it is directed towards the mind. So following good contact, like free from anchors or ego, respecting the elders or teachers, and performing regular prayers and having a peaceful mind. So all these contribute towards the acharya rasayana. Talking about the Aushadha Rasayana, here it is like consuming Aushadha. Aushadha are like medicines or medicinal plants that inherit the properties of developing the good immunity. Like consuming Amalaki, which is gooseberry, Indian gooseberry, Pipali, which is piper longum, Vidanga embolica ripes, Gugulu, which is a rasi, and Triphala, which is a group of three fruits, and Brahmi, which is a Centrala asiatica. So all these things help in increasing the bala of a person. So now we can move on to the mode of action of how exactly Rasayana helps. So Rasayana helps in improving the nourishment by improving the rasa dhatu, agni, and also the srotas. So all these things improve the nourishment, and because of improved nourishment, it improves the quality of dhatus that is formed. And because of the quality of dhatus or tissues, what happens? The person is having good longevity, and is also having good immunity, and is also having a good mental competence. So because of all these things, the person will be having a good rejuvenation. And that is how the person will be having the ability to resist some diseases and also act against prevention of a disease. So that is about Rasayana. So in short, it is like not exactly following like the Patya Ahara and Vihara that is required to maintain a good immunity in a body. There are many other factors as well. And that is why I have included all these things in this presentation. And that is how I would like to deliver the topic of immunity in Ayurveda. Thank you.
Ma'am, can we take some questions from our participants?
Yes, sure, ma'am.
Yeah. Yeah. Now, ma'am has given her permission. Feel free to ask your queries regarding how to build immunity with different types of rasayana. She has beautifully mentioned in a nutshell. Okay, ma'am, I would like to ask a question is that can any person, as you have mentioned about Amalaki, about Triphala, can any person with existing disorders can also take that? Is it safe to do regularly one gooseberry along with their food in the morning or in the lunch, one gooseberry fresh? Can they keep taking it, or is there some restriction for that?
Yes, there are some restrictions. Like, for example, if we take the concept of daily consumption of amalaki or like a gooseberry, it is fine. Like it may work with everyone. But let us consider the concept of Trifala Rasayana. Trifala Rasayana is also a mild purgative. So if you consume that Trifala Rasayana on daily basis, it may not be working the very healthy way in a person who is having a mrudu koshta, or a person who is prone to get more of the diarrhea kind of disorders, or a person having irritable bowel syndrome. So in all of these conditions, there would be diarrhea as a presentation. So in that person, if we give a laxative kind of drug, it may act more worse. So that is why, so while administering the rasayana also, it is to be considering the disease or the pathology. If anything existing pathology is there, we need to consider that as well before administering the drug. If it is amalaki, it is fine, but still if a patient is having increased diabetic, like sugar levels, and if the person is under hypoglycemic drugs, and along with that, if a person is taking amalaki or amla juice, it may actually cause hypoglycemia. So that is one thing that we have to keep in mind. So it is not suitable for everyone. So like in on a daily basis, we can take curcuma longa or like a turmeric powder as one of the immune boosting drug. But apart from that, we can't take all other drugs as immune boosters.
We have a question from our one of our patron, Narendra Kumar Rathorji. He has asked that when should Chyawanprash be taken? Morning, afternoon, or evening? Before or after food? Any particular season it should be taken? So he has requested for your guidance on the same, ma'am.
Yes, Chyawanprash is a very good drug that can increase the immunity. But one thing that we have to take in mind is like Chyawanprash is a lehya. So in lehya, there would be always a amount of sugar as well, or sugar content also. So we need to confirm that the person is not having diabetes or any sugar level related disorders, and type 1 type 2 diabetes. If a person is not having this, then okay, we can go for Chyawanprash intake. And that too, preferably I would suggest it in empty stomach. Rasayanas work well in empty stomach. So that is the time when the person will be having good acne to digest the thing. So that is it. So preferably in the morning before food, in empty stomach. That is the time that I can advise. And particular season, no, nothing like that. We can take in any seasons, but to be more precise, I would like to avoid the cold seasons for a person who is more prone to kaphaja disorders, or who is more prone to respiratory kind of disorders. In those people, if a lehia is being consumed, there are chances that there might be some nose blocks, or like turbinate hypertrophies. All these things might happen. So there were cases also I have encountered in some patients. So that is one thing that I can tell from my clinical practice.
Another person has asked a question. Any easy lifestyle changes to remove hernia, any ahar or exercise or any particular fruit or similar?
Okay. So hernia is a condition where the abdominal organs or something has been protruded out. So here what we have to strictly keep in mind is the avoiding of any kind of exercises that increase the intra-abdominal pressure. So if a person is having any kind of foods or something that may cause the belching, or like it may cause the abdominal distension, all these things contribute towards increased abdominal pressure, and that may lead to worsening of this hernia. So that is one thing that I have to highlight. Another is about the exercises. No, I won't suggest any kind of exercises for the person, because if that is done, then again the intra-abdominal pressure is going to increase, and that is going to worsen the condition as well. So if a person is having hernia, we need to know which stage is that person having it. If it is the third stage, then we'll have to go for a surgical correction itself. So with a mesh. preferably, and so that this condition does not recur. Otherwise, even if it is in the very first stages also, a patient should go for bandaging or kind of procedures where the abdominal organs have been a bit tucked inside so that the hernia does not protrude outside. That is it.
Noted.
And shall I ask one question?
Yes, please.
So, ma'am, regarding this Chyawanprash, I am a diabetic patient. I take Chyawanprash, company I won't say, wherein it is written that safe for diabetics. Is it really safe for diabetics, or is it with sugar or without sugar? Because I get sweet test in it. So is it advisable to continue? Because it is equally sweet than a laddu or whatever sweet it is. So I sometimes I doubt whether it is really safe for diabetics or not. So will you please highlight? Please.
So here, Chyawanprash, it is like different pharmacies produce Chyawanprash in the name. If you are taking the classical formulation, Chyawanprash consists of Sita, which is sugar, and it is also containing Guda as well. So here we need to consider that things might actually increase the sugar levels in a person. But there are pharmacies where they claim that they don't use any kind of such kind of drugs, and it is safe for diabetic patients. So here, if you are taking the Chyawanprash from a trustworthy pharmacy, then I would suggest then it is okay to consume. But still, I doubt the existence of such kind of preparation. So to be on the safer side, I would like to suggest you to keep the sugar levels on a check while consuming this Chyawanprash, and you may also go for HbA1c test so that you will get a count of like 3 months together. So you can compare like before the Chyawanprash intake and after intake, so you will get an approx about how it is working.
Ma'am, findings are all within the limit, and even after consuming that Chyawanprash, and that company is very reputed. It's very old and very reputed. So, but somehow I doubt. I want to clear that doubt. For that, I put my question.
No, there are other medications. Like if at all this Sita is being reduced, that sugar is reduced and Jaggery is increased, again you will get a sweet kind of formulation. Yes, and even the honey is also one part of it. So if honey is also put in it, that is also causing a sweet taste. So that is one thing for the sweet taste, and there is also other drugs that is having the sweet taste. So that is also there in this formulation. So because of all these things, you may have the sweet taste, whereas I'm telling, like if it is not causing any kind of variations in your blood reports, then it is well, it is okay to consume it. The sweetness might be because of the ingredients used in it.
Thank you. One more question regarding this exercise. You told how to know that my exercise is done. So you told it should be half of the strength, half of the personal strength. So to know that when I have reached the half of the personal strength, you told some sweating on forehead. I'm not prone to that much sweating, because after much work I get some because my sweat glands might be not working properly. So what are the other factors through which we can know that okay, I am done, that is half done? Because I do some exercise, is some fatigue, some sort of fatigue, or some sort of breathing, heaviness in breathing, are those the factor, or only by seeing the sweat on the forehead I should stop? Will you please advise?
It is so the formation of sweat that acharyas have mentioned is for the swastha purusha. So if at all, that means it is for the healthy person. So if at all a person is having some kind of pathologies, then based on the pathologies, the person might be having some variations. Like if a person is having some cardiac related issues, then the person might be having some kind of chest discomforts, or it might be like some breathing issues, or the person might be feeling a bit of giddiness or lightheadedness. So all these are part of this. So based upon the pathology, we need to alter the characteristics characteristics also. Like instead of checking for the sweat, we can always go for the giddiness, dizziness that the patient feels, or lightheadedness, or if at all the patient thinks that they are feeling thirst. All these things are part of identifying when to stop the exercise. If a person continues exercise more than this limit, then it is more cardio destructive. So that is one thing, and that is the reason most of the gym workers and all this get such kind of disorders, and they just fall off during the exercise. So that might be the probable reason.
Okay, is this statement is true for even light exercise? What you have told?
Light exercise, it is fine.
Fine, no? Oh, thank you.
Light exercise is also fine, but the matter is like everything in a more quantity is going to harm the person. So even if it is considered to be as light, if a person is thinking like it is light, so I can do how much ever I want, no, that is not going to work. See, even if it is a example of pranayama also, there is a particular count when we have to stop pranayama. So if at all we are taking the breaths more than the required thing, then we may feel some sort of giddiness, dizziness, headaches. All these things are actually the complications. So that is also having a limit. So we may not think about such kind of extents where pranayama also causing some kind of discomforts. But that is what we have to consider while doing light exercise also. We need to consider when the body is getting discomfort, and we have to stop right there.
Right. Thank you, ma'am. Thank you very much. Thank you.
Yes. Yes, ma'am. We have another question. It is, when should one person exercise at morning only? Current lifestyle forces many to do late evening gymming or exercise like walking. Is it convenient? I think he is trying to clarify that exercising in the evening, is it a good idea or not from the Ayurvedic perspective?
Yes. So acharyas have explained about vyayama in the morning, and that is because they have explained about the routine that has to be done before the food consumption, so that the person should be strictly without any food, or like in empty stomach while doing the exercise. So that is the concept. If a person is able to do the evening exercise like without consuming much of the heavy foods or something, then it is well and good. But usually what happens is like after the work, what we do is like we drink some chai, we drink some snacks and all those, make our tummy full, and then we go for some walking or those things. So which is not advised by the acharyas in Ayurveda. So they strictly say that if a person consumes food and then they go for vyayama or some exercise, what happens is like there might be production of ama, and that might may later cause some diseases. So that is one understanding. So here we need to understand that if a person is preferably going for some evening gym or walking or something, strictly the person should not consume anything if anything heavy, that's all. Like if a person can restrict to some fruits or something, some one banana or one apple or some grapes, okay, fine, but not more than that. Like if a person is consuming chai in empty stomach, then again it is going to aggravate the acidity kind of issues, and along with that, if a person is going for exercise, then it is again going to aggravate the acidity related issues. So because instead of that, the person can resort to some kind of fruit intake before the evening exercise or gym or whatever, and then they can go for this, so that it is okay for the body to perform.
Yeah, thank you so much for this clarification. Yes. We have another question. The question is that there are some infos regarding the vaccines that were used during the COVID, which is now causing lots of side effects like clotting and finally giving heart attacks to the people, of very young people. So, is it really true from your scientific observation? And also he has asked, can one avoid such allopathic vaccination and rely only on Ayurveda Chikitsa for prevention against COVID like viral infection or pathogenic in a pandemic? If so, so what is the Ayurvedic equivalent for that vaccinations?
In our clinical practice, while I was working in a hospital, I have encountered patients who have come with CVA, which is a stroke, after the vaccine intake, and even some people have come because of the clotting factors and all these things, gangrenes. So these are the things that has happened because of the vaccine. So, but there are no scientific proofs that we can prove that it is because of this exactly. No, we don't have any such proofs. But the history, common history that they have relieved is about the revealed is about this vaccine. So that was one finding that I have come across in my hospital experience. And talking about the other methods apart from this vaccine, yes, we can go for vaccines if a person is not consuming such kind of aharas or viharas or rasayana kind of therapies. If the person is more prone to diseases, if the person is having reduced immunity, then yes, the patient has to go for vaccines. But if a person is having good immunity, good bala and all these things, then they need not rely upon those vaccines, and they can continue some ayurvedic kind of drugs. So here, if COVID-19 is considered, we need to consider about pranavaha srotas. So any kind of rasayanas that can improve the pranavaha srotas can be administered to the patients. And like yashtimadu or some chavanprash, all these things can actually improve the respiratory functions. So this is considered to be as good to prevent the disease. But vaccines are those for those who do not have that acquired immunity. So that is how I can clarify this.
Ma'am, it is my question, adding to the question of the prior person. Is Hemagarbha Potali or that kind of formulation can be used as immunity builder if taken over a period entire lifetime? Is it a good idea, especially for countries like India where we have no such restriction for usage of rasa medicine? Is it a good idea to take 1 gram to 2 grams of Hemagarbha Potali in a month and continue to keep the immunity level up? Anything from your clinical understanding?
While explaining the concept of rasayana, acharyas have mentioned that any rasayana has to be consumed only for 1 month. So after the consumption of the rasayana, after 1 month, the person has to discontinue it strictly. Because if it is continued for more than 1 month, then what happens is like it becomes satmya to the body and it does not perform the action that is required. So that is why we have to reduce the consumption or like strictly stop it. That is it. And talking about rasa preparations, there are no scientific proofs that it is not having any kind of side effects. No, there are side effects also. There are toxicity effects also. So we need to taper it, and better if we go for some other natural products like amalaki or some other drugs instead of going for rasa preparations. So even if we are opting for rasa preparations, again we need to consider the hepatotoxicity also. So if a person is having some liver related issues or like kidney related renal issues, then again we have to think twice while giving this drug. That is my understanding.
Ma'am, it is very insightful, ma'am. This, especially the 1 month concept that our acharyas has given us, and you clarified, that really makes us sense. Okay. There is a question: is idli and dosa good for people who have not taken it from childhood regularly, particularly people from northern or eastern India?
Okay. So this is what I have explained about the Satmya. That means if a person is Satmya, or if a person is having the compatibility to take the idli or dosa, then it is well and good. But if we consider the northern states or eastern India states, they are not well accustomed to such kind of practices. So suddenly when they switch on to a new form of foods, what they develop is like they develop some kind of immunity related disorders. Like for example, it might be some irritable bowel syndrome, or like it might be other bowel related issues. So all these things might happen. So to be on the safer side, I would like to suggest the person to take little quantities at first, and that can be continued for like for some 1 month or something, and then gradually increase the amount of idli dosa if they wish to. Otherwise I would strictly recommend no, because there are patients who have complained about Crohn's disease, and also the tropic related like celiac diseases, because of the variations in the food that they had to encounter because of the place change that they had. Like if a person was in India, he was accustomed to taking of more of the chapati and rotis and all these things. But when he had shifted to Africa, he had to take more of the gluten related foods, like the bread and all those things. So what happened is like they had to adjust to that, had to get accustomed to it. So it was not properly possible, and he got grahani. So grahani is a disease that is explained in Ayurveda, where the sorry, the bowel is affected, and he had got subjected to such kind of a disease. So that is why I say like satmya is to be considered while taking a food. So if a person is not satmya to something, then it takes time to get accustomed to a food. That is it.
The same person has asked that if there is very chances, like if any biological war starts, what can be the some quick steps one can get immune from the pathogen that has been used in the atmosphere or in the water. So what is the first step we can do to protect ourselves and our loved ones?
Ayurveda describes about individualistic treatment, and it is depend upon the pathogenesis of the disease. So if it is a whatever be the biological war, what kind of symptoms it produce, based on that only we can suggest the treatment. So if it is affecting the pranavaha srotas or the respiratory system, then we have to give something that strengthens the respiratory system or is targeted towards the respiratory system. But in case if it affects some cardiovascular system, then we have to always move on to such kind of rasayanas which can strengthen the cardiovascular system. So that is the understanding of rasayana and immune boosting drugs. It is not like one thing, no, nothing can act equally well in all the conditions, no. So based on the system wise, we'll have to uh, change it. That is it.
Yeah, just a continuation of this question. That okay, there may be 3 or 4 categories of biological war we can expect. One can affect the skin, one can affect the lungs, one can affect the heart. So, like that, can you give us some 3 or 4 protocols which need to be done?
Okay, so if we have some diseases that is related towards the pranavaha srotas, there is a possibility like if a person is getting yeshti madhujurna or like charana prasya, as I mentioned before. So all these things can strengthen the respiratory system. If it is the cardiovascular system that is getting affected, then the person can go for consumption of Arjunarishta, Partharishta. All these things can strengthen the cardiovascular system. And if a person is having some sort of urinary system or like the genitourinary system getting affected, then the best rasayana would be the Chandraprabha rasayana. So that is also Chandraprabhavati, which is a formulation in Ayurveda. So that can be administered. It is a very good rasayana as well. And Shilajatu can also be given. And if a person is having something that is related to rheumatic complaints or joint disorders, then the patient can go for Lashna rasayana, or can go for Bala rasayana, or such kind of drugs that can reduce the vata related complaints, like Gugulu Rasayana, Shilajatu Rasayana, Guru Rasayana. All these things are examples for it. So this is how various systems and the rasayanas are being opted. But still, this has to be judiciously allotted. Otherwise, what happens is, like, the person might be getting affected. So it should be strictly under the guidance of a physician, as per my advice.
Shall I ask one question, ma'am?
Yes,
Shall I ask?
sure, sir.
Yes, Narendraji, I have a question. Then you can ask one. Just give me
Oh,
1 minute.
oh yes,
Yeah. Thank you for
fine.
your understanding. Yeah, thank you. Ma'am, Vijayji has asked that your presentation for Rasayana was very insightful, but nowadays most of the manufacturers, as we know, are putting preservatives like sodium benzoate and so many preservatives. So true. So in your clinical practice over so many years, and you have grown up in the atmosphere of Ayurveda. So from your which do you recommend any specific manufacturers who are still trying to follow the same classical formulations, how to make them with less or nil amount of the preservatives?
This is actually indeed a very important question also to discuss. But if I point out some manufacturers, then it would be very unfair. So I would not like to answer this question. But yes, for some preparations, I have, as ma'am has already mentioned, my mom is also related to Ayurveda. So she is also a MD holder in the pharmaceutical science in Ayurveda. So she has went to many of the pharmacies and she knows what exactly is being added for each of the preparations. So some kind of preparations she used to suggest some pharmacies, another preparations she suggests other pharmacies. So that is how we recommend for medicines. But as a whole, I won't say which manufacturers might be producing more reliable drugs. No, I can't say it because it would be very unfair. Sorry for that reply.
No, ma'am. You opened up another opportunity for us to interact with Dr. Shalina ji, so that she can give us more insight into that, because she has explored the dimensions. So you just opened up another webinar topic for us. We are so grateful to you, ma'am.
Thank you.
Yes. Yes, Narendra ji, please feel free
Yes,
to ask the question.
ma'am.
Yes,
As
sir.
I know that, this immunity acts in two ways. One, it has some preventive quality and curative quality. So this, suppose if I think I am immune, I am a layman. If I think I am immune, to what extent I am immune? To the extent that I can fight with this viral infections, or any food adulteration problem, or there should be some yardstick to measure that, okay, I am satisfied with whatever immunity I have. So that I can be complacent that, okay, no, nothing will happen to me. Is there anything, any sort of, can you detail this one? Suppose if I think that I am immune, but I am not immune. I am not getting any cough, cold, or fever. So I am complacent that I am immune. But I have but that immunity level is not up to the mark. How can I be sure that my immunity level is up to the mark to fight all these impending issues? Thank you.
So, immunity is actually a very vast concept. And to understand this, I would like to say that if you are not getting some diseases frequently, so that is it. The frequency of the diseases might be different for different person. So if you're getting some diseases frequently, then it means that your immunity level is very low. But if you are not getting that frequently diseases, then it means that your immunity is well and good. But still, next topic that next point that we have to consider is, if at all you are getting a disease, if you are able to fight it back very easily, then it means that your immunity power is good. But if you get a disease and if you are not able to fight it back very easily, then it means that your immunity level is still on the lower side. So that is where we have to administer the immune boosting drugs or something, medicaments, so that the person's immunity level is raised. So while assessing your life itself, you will come to know like which system are you getting more the diseases, like is it towards the gastrointestinal, or is it towards the respiratory, or is it towards the cardiovascular? So whatever it is, you have to assess which system are you getting the diseases more frequently. So by that assessment, you can understand like, okay, this system is weak in me. So you can give some medicines or some ahara or vihara, which is boosting the immunity in that system, so that you are not afflicted with any kind of diseases. But still, diseases are out of our control. We can't say whether we will be fully immune towards some diseases. There may be competitions also. Even if you are getting some disease also, it is depending upon the immunity level, that how well you can fight it back. That is it. So if you have a good immunity power, you can fight it back very well, very soon. Otherwise, it may take some time. That is it. And as sir is bit towards the older age, I guess, so it takes time to immune or like immune ourselves from the disease. So that is one another factor that we should not forget.
Yeah, we are almost towards the end of our beautiful webinar. It was so insightful. Any more questions? Okay. Ma'am, we are so blessed to have you today with us. You enlightened us on the Rasayana, how to use the different Rasayana, not only depend only on the formulations, medicine, even exercise, proper diet, sleep, which we are highly deprived of in the modern time, that also has proper Rasayana effect. So it was very, very insightful. We'd like to have you again in future sessions where you can open another way of seeing the different practices to enhance our health. And
Thank you, ma'am.
thank you so
First
much
of
for
all,
giving us the time.
Let me just thank the foundation who have given me the opportunity to spend few minutes in explaining this topic, which is very relevant in Ayurveda. And I'm just feeling so much privileged to be part of this Pranashakti Foundation. And thank you, Dr. Shamista, for approaching me for the webinar. And
Yes,
thank you all the members for the patience hearing.
yes, we are so grateful for all the participants, and thank you, ma'am. Thank you so much. It was a very insightful evening. Every week we have, and every week we are prioritizing our health, because it is a wealth with which we can enjoy our life to the last days. Thank you so much, ma'am. Have a great evening. Thank you. Pranam to all. Pranam to all.
Thank you, ma'am. Thank you.
Thank you.